And everybody just. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have in attendance tonight legislators Elaine Daly, Amy Sargent, Bob Shea, Tom Winslow, and myself. So we're all here. First order of business is to get a motion to approve the minutes of July 9th.
I'll move the minutes.
I'll second.
Any discussion about the minutes? Hearing none, all in favor?
Aye.
Any opposed? Moved. We have some appointments that will be coming up for vote at the full legislative meeting. Community Services, new board member would be Emily Hitchcock. Mental Health Subcommittee member, Carol Colvin, and an Alcohol and Substance Use Subcommittee, Jean Canizzo. I want to just state that you will find that Jean Canizzo sits on the Community Services Board, but one of the bylaws pieces is that members of the Community Service Board do have to fill one place on each of the subcommittees. So it's not as if there's a stacking and using, one person to fill several positions within that board. Okay, I'm going to stay in order here. I will say that Brenda Wyman is excused this evening, and so is Deborah Dennis. They are both out of town on vacation. If anybody has questions about Deborah's report, well, Deborah had no report, no updates. About Brenda Wyman's report, I can get them to her. Any questions? She is, one thing I can tell you is that they nearly doubled the amount of coupon packets that they received for the older population that are income eligible, and they actually have 600 more packets of these to get out. So there will be they're organizing another drive-through for August, end of August, and getting some up again in Fairhaven near the end of September. But she's encouraging anybody that knows elderly who may be eligible for this program to put out the word, because it's great that they got this many more coupons. But last year, they just, with all of their advertising and events, they just were able to get out what they were given. So we need to use these so we can continue to get more. But it's about, the need is out there. It's just about getting the elderly to know that they're eligible and get them picked up.
The only thing I was going to ask her, and maybe since you're on the advisory, is the ISEP program, expanded in home services for the elderly, is currently near capacity for aid service, meaning there's no more funds because they've been able to provide so much service, or the two aides are fully booked and they have more money, but they don't have room for any cases. So
Two aides are fully booked,
okay,
no room for any more cases
not by finance, but by bodies.
by bodies. But that has impacted finances because they're working at that rate. So it's a kind of,
Yeah, I remember before they used to give ISEP money back because they could not provide aid
Yeah.
service. And now they have this arrangement. So I was just curious
Right.
if it's,
Yeah.
we can wait till next.
so, but
yeah.
it's at capacity, but it's also, they're going to be at a place where they're going to use all the funding. And then they're worried because there will be folks who will potentially lose aids, et cetera. So good question about that. All right, we will just follow the agenda. Health Department. Kathleen is here. Hello. one resolution. Why don't we cover the resolution first and updates? HH1 is authorizing the public health director to reimburse the sheriff's department and the county attorney's office for services provided. Before there's discussion on this, from Director Cuddy, can I have a motion for discussion
I'll move, HH1.
and a second?
I'll second.
Okay, so it's on the table and get us up to date.
It's pretty self-explanatory. The sheriff department and county attorney's office provided some additional outside of typical work for us related to some Article 6 reimbursable work that we had to do. And as a health department, we are able to draw down state aid. So while the sheriff department might pay in its first instance, if we're able to adjust the budgets accordingly as per this, then we'll be able to draw down some state aid funding against that expenditure.
Question. The only question I had is, it looks like you're adding 15, are you adding 59,000 to your professional services, or you're using, I mean, because you're not asking to transfer money, so I don't know.
Is Lynn Marinelli on here? She's not. I'd like to get her on the phone to explain that because she will explain it much better than I'm able to. That is exactly the question I anticipated you asking. And I want to be particular on the language I use openly to.
Okay, thank you.
Because certainly
We're
was
not
not
ask-
anticipated.
Right. We're
This
not
is
asking for
February.
additional funding.
Right.
The health department is not.
We can wait till Ways, Kathleen.
Um,
I think it's important. I know that
Maybe,
the,
maybe it
the
won't be
sheriff was
asked at waste.
concerned he
if we
wouldn't get
do it now.
reimbursed, so this
Oh.
is.
So she's not available, but this is really a very specific and deliberate way to show that the money was spent in the work that is Article 6 eligible. But because the sheriff department has spent it in the first instance, we are going to show for audit purposes that the money is county money and we can therefore draw down Article 6 funds.
So it has to be done in a precise way so that it's recognized as spent and claimed. You've spent it and the reimbursement will come, but where the money came from, she can answer. Okay,
It's already been spent in the sheriff's budget. That's where it came from.
okay.
Mhm. He's made that clear to us.
Yes,
But this maybe then just be an authorizing resolution that
This is-
no,
This is for audit purposes to
Okay.
show
okay, so it's not
how the
that,
money's being spent.
okay.
Mhm.
It's not that it was in your line, it's,
Correct.
okay, this will make it kosher so that this is a health department expense.
Yes,
Because the Article 6 is a health
you
department,
got it.
it's health
Yes,
department law.
the sheriff department would never be able to claim that.
Right.
We can,
Right.
however.
That was a good question for clarity.
Mhm.
Makes it very important to know that. Do you have any comment on that? Did you work with Lynn or anybody on the
No.
legalities of moving it to to Article 6 coverage?
Kathleen is correct. I would be less than precise.
Okay,
So it'd be better to get the precise reason for doing it this way. But as Kathleen said, it is for audit purposes and the ability to draw it down and disperse the money is what that's.
It's a legitimate claim then.
Yes.
That's as far as I dare go.
Yeah.
Yes.
so good. Okay,
Correct. It's best for the taxpayers locally.
any other questions or discussion? Because if there's people who are feeling very unsure about this, it could be moved to Ways and Means until there's, point of clarity.
I'll follow up with her, and if there's something that still is unclear, then we can talk about it at Ways.
We could
Yep.
talk about it in Ways, yes. Amendment or.
Great.
Okay.
Thank you.
I think we should make it a point of clarifying
Yes.
the
Oh,
transaction,
Yes.
even though it's, it's.
Past this, but we wanted further clarification.
Yep.
Yep, and we'll get it at ways if she doesn't get onto the meeting.
Agreed, agreed. I'll follow up with Elaine and we'll make that happen. Any other questions, discussion? Hearing none, all in favor of HH1?
Aye.
Okay. Any opposed? HH1 passes. So we'd like to hear your updates.
Great. So I put a few updates in the agenda. Right, we had a good turnout for the WIC Latching Littles event that we did with some community partners. Community health services, there's a lot of immunization work going on. I think some of you, everybody should have received in their email, and we put our press release out that our community health assessment is out. And I encourage and ask all of you to take this. We want to get as many responses as possible, and we want responses from across the county. So there is a way, it's the best way and the most efficient way is to do it online. But we have an intern for about a week remaining. So we're putting that person out in the field to try and do some paper things in more rural areas and have some paper surveys.
Is name optional?
Oh, it's anonymous, correct. It is anonymous. You don't need to put your name in.
Put a name.
No, we do ask for zip codes, so we know the areas that people are coming from, but it's irrelevant. If you're over 18.
Yep.
That's all we care.
Okay.
And a Cayuga County resident. A lot of work in health education related programs. I keep talking about this renovation, repair and painting course, and this is probably like the third or fourth time that we've held this at no charge for people who will benefit. We're really targeting property owners who are renters because the whole purpose behind this is to diminish lead paint in rental properties. You could be a homeowner of an old home and take this also. You don't have to have a rental property. But because the rental registry is forthcoming, and this is a New York state law that the local health departments are being asked to uphold, and this law applies to areas of high risk, which 13021 zip code is an area of high risk because of the age of our housing and the number of children who have been identified with lead poisoning. We're getting this additional funding, and I'm absolutely going to be talking more with this committee in the future about positions that we're going to need to perform this job and that we are tasked with. I'll talk just a little bit about it in the fact that we are requesting some new job creations. We had just gone to the Personnel Committee, and with Civil Service Committee, we'll be going back to the Personnel Committee with a couple other things, but we're looking to see if we can create environmental health technicians to be able to go out into the homes and assess these properties, of which we're being told there's at least 4,000 units. These 4,000 units will need to be surveyed at least once every 3 years and assessed for lead paint hazards, both a visual assessment if necessary. If there's deteriorating paint in those areas, then we'll get in with our XRF to identify lead paint hazards. And then it becomes, following up with notice and demand practices, going before our Board of Health. It's a whole health process and a legal process to get compliance from the property owners to bring their lead hazards back into compliance so that they're not hazardous to children. So that's kind of in a nutshell what the purpose is. It's going to be a tremendous undertaking. There's a database that New York State Department of Health is supposed to have put together. It is not ready yet. It probably will not be ready at the time that this law goes into effect. So we will have to start tracking some of this ourselves and going out. We'll probably start with like the low hanging fruit, right? People who are very open to having us come in and getting their certifications that the health department has visualized their properties. A lot of our Section 8 housing is has to stay in compliance with so many other regulations that they're kind of like the easy ones to start with, so to speak, right? And some apartment complexes might be easier ones to start with. It's those apartments that are in older homes, right, that are going to be challenging.
And it's the law, Kathleen. When does the law go into effect?
November of this year, right? It was drafted a year and a half ago. We started getting funding. We haven't even spent any of the funding because we didn't have a good sense of the expectations. But it's coming to fruition. The law is going to go into effect. So the state is giving a little bit of guidance to say, start doing something, people, health departments.
And they've actually decided what the characteristics of the property that would be on this registry, and that's how you're gonna go.
Yes, it has to be a 2-unit or more. I don't think that there is an exemption for the age of the property. Although we don't, I mean, a larger housing complex that was built after a certain age is not going to have any lead problems. So that's going to be one of those no-brainers, right? That's an easy one.
So double house,
Double house,
right?
yes, yep.
But targeted toward rental property, not
Correct. No.
owner
Well,
occupied.
so if I own, however, if I live in one side of my duplex and I rent the other side, if I'm renting it, now if my relative lives there and I'm not taking rent from them, I guess it's not a rental property.
Right.
Right. But it's it is exactly moving forward. It's policy to move forward to try and help prevent lead poisoning because it is an issue, right? It's an issue in our communities. And we are one of about 20 communities across the state who's getting this funding and that this is targeted. Some of them have a much bigger geographic, multiple zip codes.
Does this provide for an assessment and a remedy to homes with lead paint? I mean, you don't want to take it off, you don't want to sand it.
Right.
I didn't know if it included encapsulating or.
So
painting.
it depends how big the area is. And that's where we have to send these people to lead training. To EPA assessment training will help with identifying whether it's appropriate for encapsulation versus abatement or, remediation in some other capacity. That's why we've been trying to get the word out to the property. Like landlords theoretically should know that this is coming, but we don't know how much they know because we didn't know very much yet, right, about this law. We were only hearing things. But because this was coming down the pipe, this renovation, repair, and painting courses, we've been offering that via the lead prevention grant funding that we have. And we're trying to get people, because this is something that may help those property owners do it themselves. It's far less expensive than having to hire someone who's a lead abatement specialist if there's an issue.
Could you remind me again how much money we have to spread out on this topic?
So the renovation, repair, and painting course is like an $800 value for people who take it, right? That's a grant. The prevention grant is one set of money that's helping sponsor this. The lead registry grant is like $500,000 annually that we're getting to pay for personnel to execute and enforce this new legislation.
This is a new mandate for the
It's a
health.
new mandate and it's being given to health departments. Yeah.
Are they doing any PR on it? Is the state doing any, hey, did you know landlords, this is coming? Or is that worth it?
I don't know how they're getting the word out.
Mhm.
I don't know. If there is an expectation that we use some of this money locally
To get
to try and do that.
Yes.
Yep. So that's something we can do. We don't have capacity for that right now. When we hire people to work in this program, they need to learn the details of it. And we'll ask them to work, to develop some education for our property owners.
And I mean, I do see, for instance, on the, so it's already happened.
Yeah.
The 1st of August, you held a repair and painting course.
Yes.
I'm hoping that maybe landlords were there.
Yes, and that's, so we have been working, we sent out mailings through this to landlords' names we know who have had lead paint issues in the past. there are some landlord associations. We communicated with them, some realtor associations. We communicate through them. The city at one point in time had looked to pull some sort of a registry together that did not come to fruition for various, reasons, but they are able to offer names to us as well. We don't have the database, right, to say like, oh, here's the list of all the multi-unit owners. Well, mail it to them. So it's so much to undertake for the detail, and it has not been our priority, right? Getting some of these prevention classes out has been a really bonus thing that we've offered over the last year and a half in anticipation of this. But now we have to take action on staffing for this program and starting to get the education out, and then starting to do, maintain a spreadsheet of sorts of some of the inspections that we've been doing, and then follow up. We'll have to get it consequence. We have a process for, they call it notice and demands, that get sent to property owners who have, when there's a child with an elevated blood lead level in a unit, it puts a timeline on them getting the lead paint problem remediated. We anticipate we will have to be doing some of that also, right? So it's a thing, and I'll try to write it out a little more succinctly next time. I'm kind of talking off the top of my head. I didn't come really prepared to speak in detail to the registry, but that reminded me this is just a good time to talk about it, because we will absolutely need personnel to do this. We cannot take on anything more. Environmental is just swallowing up Deanna and I, along with our staff who are doing it, because of our vacancies currently. And, they're significant vacancies, but we did have one of our people who was on FMLA is now back at work. So they started back this week. So that will help somewhat.
Bit of a
Yeah.
relief, yeah.
But without our director, I tell you that I have an appreciation, but it's a lot this time of year, and it's a lot with, the other stuff that you do. So it's taking a little longer to get some things done, but we seem to be moving forward. That's good. Harmful algal blooms, they're in the water. We started the Auburn water treatment plant and the Owasco water treatment plant began testing this week. The raw water and then the treated drinking water. And the first round of testing is all good. There's no detection of microcystin in the water. And we do post that to a public website on the health department page. Preschool special education. We've been working, we're getting transportation together for our children for the fall programs. That's, it's an undertaking. Finance is doing a great job starting to work on the 2026 budget. That's kind of in the various departments. We had a call yesterday, and I don't have great notes on. I'm just going to hit just a few highlights. These are not the official notes from this meeting, but our state health organization, ISHO, had the National Association of City and County Health Officials speak with us about some of the federal funding program cuts that have happened and things that we'll anticipate both. So I have just a few little things, but when we get the official minutes and the PowerPoint, I'll share that with people so that they can look at it a little bit more themselves. We know that some restrictions that will impact the local health department will likely be through public health emergency preparedness. That is an area that the federal government has indicated they want to maintain to a degree, but they've made cuts, unlike some programs. Other areas that will be cut, we don't know yet by how much, are chronic disease prevention and injury prevention programs.
Was there federal too, Kathleen?
There are some funds that come down. So how that impacts us directly. So preparedness, we have emergency preparedness is pretty clear. We have funding that helps support injury prevention and chronic disease, like our Healthy Neighborhoods program. To my knowledge, that's mostly state-based, but I don't know if the state's getting some of their funding from the feds on that.
But more to come, right?
More to, oh, definitely more to come. There's, different funding is being eliminated or consolidated into block grants. There are eliminations they're looking at that will impact some health departments, not ours as much because we don't have a lot of direct programs in these areas, but for HIV funding, healthcare associated infections, climate funds, and firearm injury research. There's going to be decreases to SAMHSA, which is our mental health. And some other agencies, I'm sure, and social services will speak better to this because this is not my area of expertise. There's changes to Medicaid and SNAP, right, formerly known as food stamps, that will include immigration restrictions, eligibility restrictions, work requirements. The Congressional Budget Office projected over the next 9 years, 10 million people will lose health insurance as a result of that. Reorganization is happening, about 20,000 people from HHS at the federal level appear to have been laid off or taken incentives to leave employment. And initially, I guess FEMA was being looked at to be dismantled, but because of the floods in Texas, they're looking for some reorganization. So right now, some of these changes, though, that was one of the things that we were concerned about, from a local health issue was whether any of these bits were going to impact how emergency rooms or federally qualifying healthcare centers receive, but so far it does not appear that any of this should change how emergency services and the FQHCs serve people, which is good, right? Because that means people shouldn't be turned away who have emergency care in that regard. So there's my uplifting information to share, but this is those are very nebulous notes, and they're not the official minutes from it. So I'll try to get something again that's a little easier to read as we get it.
Look forward to a couple of those updates.
Great,
Thank you.
thanks.
Chair, before Kathleen, I see Lynn Marin.
Oh, Lynn Marinelli is on.
Oh.
Great.
You want to take care of it?
Yes. I see that Lynn Marinelli's on. Lynn, we do want some clarity on HH1. It has been passed, and we were just going to make sure that the clarity around how the funding moved around to meet the requirements for Article 6 occurred. Lynn, I'm not sure if this is Heidi with HHS. I'm not sure if you're hearing us. Oh, there we
Hi
go.
Heidi, I can hear you now.
Okay,
I was on the
thanks.
phone, sorry about that.
Okay, so we have passed HH1, but there was discussion that we were gonna look to you for more clarity and maybe bring that to Ways and Means. The clarity was around, there were questions around how it works so that you could move monies in such a way that we met the Article 6.
Yeah, I mean, what they were doing is really a budget adjustment to increase their expenditures in the health department. And then we're offsetting it with an increase in revenues in the sheriff's department. So in total, it's a budget neutral thing to the 2025 budget. And then the health department has to show the expense in their budget, even though the sheriff right now has the expense for the people that he paid to work overtime. So this way, it's almost like Kathleen hired them to do the service for them, for the health department to, supervise this individual. They'll pay for the service, and then that's eligible for some reimbursement by the state. So they'll put that on their claim. So this just makes it so that she's actually able to pay the sheriff. Otherwise, she doesn't have a, expenditure budget, and then he'll get the revenue because they're gonna basically be paying him.
Okay, any questions?
Yeah, it was just my kind of trying to think this through. the 59,000 didn't come out of the health department's budget?
No, the sheriff paid it in overtime.
Right.
Right now, he has just
Right.
paid it. So this way, the health department can reimburse them for the services provided as if they'd hired them, which she is hiring them. She's doing an MOU. It's kind of after the
Mhm.
fact, but that's, hiring from the service.
Yeah,
Is what
So
she's
the
doing.
59,000 came from his budget?
To start with, I mean, it's in his
Yes.
overtime.
originally.
Yes.
Yeah. Yeah.
And
they
that's
just
where,
paid-
that's where it got transferred from there to here.
No, it's not really transferring it. We're doing a budget adjustment, and then he's going to end up with revenue in his accounts to offset his expense,
Okay,
right? Think of it as if the town of Moravia hired him. They would then send him a check in the mail and he'd get the revenue to offset his overtime. He does that sometimes too. So then it costs the county nothing. So his budget will look better now. He's going to get some revenue from the health department to offset his overtime.
yep.
The health department ends up with a bigger expense, and then they will claim that for some state aid. So it's a way to get some state aid to help offset this service at the county.
So this is,
Yeah.
excuse
Go
me,
ahead.
holy cow, it's clear as mud. So this is an expenditure to give to the state for reimbursement for the health department?
In the end, all the expenses in the health department usually go onto a state aid voucher,
Yep,
so they can get some reimbursement.
okay. And this just makes the sheriff's department whole with that being done?
Yes, and yep.
Okay, I was right, clear as mud.
Yeah, it's like a paper trail to show that the health department is making this payment on behalf of the county.
Correct, and to meet.
Right,
the
because I mean,
requirements
you
of
could
Article
imagine that
6.
she could have hired somebody else. I mean, you could imagine that she could have hired the Auburn City Police Department to provide the supervision. I mean, it could have been, and then she would have had to pay for those
Yeah.
services.
And the confusing part, it's already been paid and it's already happened. We're doing this after the fact. That makes it a little bit stranger.
Right, because they really can't just pick up an expense of the sheriff and put it on a state aid voucher as a health department
Yeah.
expenditure. It has to kind of go through the health department.
That helps.
I'm relying on our excellent accounting people to make sure that audit wise, that's what it follows. And that is a good thing.
And I'm seeing now heads are nodding yes, so I'll take that as a point of understanding, but if there are any more questions while Lynn is here.
No, I think the way to make sense of this is happening after the fact.
As
so
a
that you
budget
could take advantage of the
adjustment.
claiming.
Right.
Yes.
Thank you, Lynn.
Yep.
Okay, thank you.
Good.
Thank you.
Thank you.
Thanks.
I'm going to skip ahead to stay in order on the agenda regarding our resolution. So, Jean Bianco, if you want to start with your resolutions in social services. HH2 is amending the social services 2025 budget to accept the 100% funding for the flexible fund for family services.
I'll move. So you're gonna have her go through them all or just one at a time or?
Why don't we do what moves more quickly, really, when you think about it? One at a time for clarity.
I'll move HH2 then.
I'll second.
Thank you. So it's up for discussion and we'll have you.
Yep, so we're asking to amend our budget to bring in some revenue, triple FS, and up the expenditure too, so we can pay some programs that we have that we utilize triple FS funding for.
And it's $300,000 and the funding generally supports employment services for the TANF population, I understand.
For these particular contracts that we have, yes. The triple FS money is actually used. It's over $4 million. This is a small portion of it.
We moved it in second.
Yep. Any questions? Hearing none, all in favor?
Aye.
Any opposed? HH2 passes. HH3 is authorizing the chair of the legislature and the commissioner of social services to enter into a contract with Community Action Programs of Cayuga and Seneca, CAP, to perform any outreach activities for the state mandated HEAP program. That's our heating program, which is 100% federally funded for the period of September 1, 2025 through April 30th, 2026. This is pretty much an annual process for us.
I'll move HH3.
Thank you. Thank you.
Okay, just to be clear, this is 100% funded for this particular program of the HEAP work that we do. We do run over the HEAP allocation for administration. I've talked about that over the last few months. But this particular program at CAP, we will use the money that we get, and this program will be 100% federally covered with those funds. So this is the program that we have that runs through Cayuga Seneca Community Action Agency. It is the alternate certifier that we are required to have to help folks that want to apply for HEAP benefits. They can help them fill out applications, help them determine what documentation they need to submit. They can help them via the phone. They can help them in person at CAP. They see a lot of people. We actually, the budget that was submitted by CAP for this program is decreased from last year. Last year, the program budget was $146,648. It's a decrease down to $132,728. They actually reduced the number of workers in this program by one based on our ask to try to save some money. That's pretty much it. Is there any other questions about it that I can help you?
Did we give them motions?
Yes, we do.
Okay.
I'm just, okay, what was the 2024 allocation? We're down to 132,
Yeah, it was 146,648 for the 2024 contract.
Okay, so about 12.
I'm just curious why it's less than a year.
So the program for HEAP, they help us out for 6 months.
Okay.
So they bring in the staff for this program, for this alternate certified program in October, and they go through 6 months. So for 24 weeks, they have,
Is there a program timeframes?
yeah, it's not quite the beginning of the program and the end of the program, but that's what we need to help us out. We finish up, with staff that we have in-house. But it is for 4 HEAP clerks, and then a very small portion of a couple of supervisory and managerial positions there.
And because of our housing issue
Yeah.
again, we're housing at the
Yep.
actual CAP.
Correct, because we really don't have room to bring in these extra workers into 163 Genesee Street. It worked out very well last year that our DSS HEAP staff were also housed at CAP along with the CAP staff that they hire. And then we also bring in, this year, we're going to bring in 3 seasonal workers. So it's a pretty big program for a portion of the year. And, they're very busy. There's a lot of applications, a lot of work that needs to be done. I know I've talked about it before. Here.
Any questions? Anything for discussion? All in favor of HH3? Any opposed? HH3 passes. H4, authorizing the Social Service Commissioner to fill a supervising social services investigator position in the Department of Social Services. This position did go through Personnel Committee and has been part of our positions that were not part of the policy. I'll just mention that.
I'll move it.
Thank you.
I'll second.
Okay, you pretty much said it.
Right,
It is an
right.
exempted position.
Yep.
It's been vacant since April because of a retirement. And we're looking to fill that position. It is a supervisory position in case integrity. We are mandated to investigate cases that are in SNAP and Medicaid for fraud. The case integrity unit also investigates other type of fraud concerns within the department, and they help us out with the compliance checks that we do at the hotels for the folks that are unhoused that the department is working with.
And this position is minimally reimbursed at 52%.
Depending on the cases that they investigate, kind of varies the amount of reimbursement. If there's, Medicaid cases, then we get higher amount of reimbursement, but at least 52% reimbursement for the position.
Discussion, questions about HH4? Hearing none, all in favor?
Aye.
Any opposed? HH4 passes. HH5 authorizes the chair of the legislature and the Commissioner of Social Services to enter into a contract with Northwoods for provision of the software solution technology and services. This is again annual, and this is a software service that only Northwoods is able to provide. It's a specific case management software that provides time efficiency for our case managers, case workers who are out in the field and moving around a lot, but have required, state required notes and
I'll move HH5, Heidi.
thank you.
I'll second for discussion.
So,
Yep, so they are a sole source provider. We got the letter that is required. We worked with Amanda O'Grady on that. They provided us that to document that they're a sole source for this particular software that we use. We've used it for a number of years. It is very helpful, as Heidi said, for our workers that are out in the field. It's all of the child welfare staff and also our adult protective services staff. They scan all of their documents into it. It really is like this place where everything sort of lives that is related to a case. Anything that comes in by mail, any of the medical forms for children in foster care or adults that we're working with go into that. Any progress notes are put in there. And then it's a really nice place for us to hold forms that workers use when they're out in the field, so that they don't have to carry big bags of paper and try to shuffle through them. They can just fill them out like right there online with families, and they go right into that system. Much more efficient and helps with being able to extract information quickly when you need it.
So this is basically a database, for lack of a better word.
Yep, and it's very particular around how things are cataloged so that you can capture the information when you need it, because that's part of it too, is you put it in there, but you want to be able to get information out. So there's a lot of time that was spent in these folders and how to put stuff in there so that when you need to retrieve it, you know where to go to get it. It's highly sophisticated with the ability to search by like a certain term, or if you're working with a family, we know we worked with them 5, 6, 7, 8 years ago, and you remember that there was a relative that maybe would be a resource for a child, you're able to go in there, put information in, and they can pull up all of the progress notes about that particular person. So you don't have to go through files of paper. And I'll tell you, with not having any of our cases, it's been handy to have that all there.
That was my next question to ask you, what makes it worth $127,000 a year, but that was the right answer. So thank you.
Okay.
Can families sign
Yep.
and enroll in service? It would be no paper.
Yep.
This can be done right through the software.
Yes, because we have the computers like this that are all, you can write right on the screen. You can have sit right there with somebody that you're working with, and they can read that information. They can sign with a pen right there. You can send it off for a referral. You can have it in your case if that's what you needed. Release of information.
Drive back to get paperwork and then.
Make another home visit.
Yeah. Yep.
Make another home visit in a couple days, so time saver, but also like very efficient around just being able to retrieve the information later. And like I said, not having the access to all of our paper files in the county office building, this has been, thank goodness we had it.
And the remote work too, right?
yeah,
Yep, and remote, yep, all the remote work through COVID too.
okay. Any other discussions, questions?
No, just hearing the way that Christine, that you explained it, it answers all my questions as far as, how long you've been using it and what it provides for you and the efficiency of it. It sounds like it's really a useful tool.
Yep. The other thing that I wanted to just mention that I forgot to say is this is a 5-year. And so this is allowing us to enter into a 5-year plan to contract with them. That gave us the best rate because their escalation, we entered into a 5-year program, was a 2% increase each year versus if you do year to year, it was going to be higher.
This came when Ray Bizzari was in the role, right? This has been in effect.
Yes,
that
yeah,
long.
yep.
Any other questions? Hearing none. All in favor of HH5?
Aye.
Aye. Any opposed? HH5 is carried. HH6 is authorizing the chair of the ledge and the Commissioner of Social Services to contract with community action programs again for the rapid rehousing case management service. And this is 100% funded.
Yep, this is actually triple FS funds that we use for this program. So it's 100% funded. We work with TANF eligible families who are unhoused that we are providing services for. And, you know, the goal of the program is to connect people to permanent housing and also to connect them to other supports that will help them become more self-sufficient, medical, any sort of, you know, medical care, counseling, kind of you name it, job programs, like whatever it takes to help them become more self-sufficient, as well as looking for a permanent housing solution for them. This contract is also, again, less than it was last year. It came in at under $75,000, which is the threshold for the RFP through the purchasing policy. So we didn't have to do an RFP for this one this year. I think that, you know, I've talked about this program for the last couple of years. I did ask for some data just to talk a little bit about, if you're interested, how many folks they served.
Yes, very interested.
For up to August of 24, for this year, they worked with 46 unduplicated families. So 46 families came through the program. At the time of this data report, they were working with 10 open cases still. They had 13 of the, let me go back up a little bit. 37 of the 46 families had obtained permanent housing or were placed in a transitional housing program. So I asked for them to break that down a little bit more, to take a look at, well, of those 37 families, how many actually were placed into permanent housing, not transitional housing, but actual permanent housing. And it was 13 of the 37. So there was, it's not a huge number, but it was 13 of them did get placed into permanent housing. The rest of them were referred into a transitional housing program, which isn't permanent, but it's a step towards permanency. And let's see. There was also a number of families that exited due to noncompliance, lost contact with them, or they self-exited and just didn't want to work with the program anymore. There's 11 of those. And they made 83 referrals to additional programs and services for families. So, you know, I think I said the exact same thing last year. While it isn't like a huge number of families that are transitioning from this program into permanent housing, it is some. And I think that, you know, that really speaks to how expensive housing is. They're not the only program that's really struggling to find permanent housing for families with limited income, low income, you know, very low income families. And, you know, I think that, you know, we're asking to renew the contract with them for them to continue to provide the service.
I think for just over $74,000, even 13 families, when you think about what we pay per night and what resources we have per night for families who are homeless, that's a good statistic right there. Any other?
Do you have a certain amount of spots that you can hit? Like they have a caseload? Like what does that look like? That doesn't seem like a lot of money to do that.
Right. That much to do, it's one case manager. So I had the budget here. So it's only one case manager that earns about $40,000 a year. So, and then there's some fringe on that and a little bit of jury cost. And then there's things like mileage.
I mean, do you cap at a certain amount? I mean, how many families can they work with at a given time?
It's up to 14. Up at one time, they can have up to 14 families that they work with. So I think that's a good caseload number.
Mhm.
And I think the number varies depending on, you know, who we have that's coming in. If someone exits and they get another referral. So it's kind of always turning over depending on what's happening.
The ones that didn't move on, does that mean they're, what, just various things they discharged, what moved?
When they moved on,
Yeah, the ones that weren't successful.
sometimes they move, maybe they move and go out of the area. They decide to leave. So they would have exited without, you know, maybe having permit. If we don't know where they went, we can't say that they moved into permanent housing. Some of them just refuse to work with the program anymore. And so they don't work with them. Yeah. That doesn't mean that we stop working with them.
Because they're not required. They have to consent to
The
this
voluntary.
case management, right?
Yeah, well, part of their ILP program is that they work with us and they work with the services that we offer to them, but there's always, situations that happen.
And we were talking at the other meeting, just like that, if you can't really take someone off the program, you can threaten to take them off the program, but
They can have sanctions. They can have sanctions and they can, they can have consequences, but it's not as easy as just, you're no
call for a
longer.
hearing, wait, yes. Yep.
Do you have a wait list?
I don't think that there is a wait list for this right now.
Do you have other case management programs for singles as well as families?
Yep, we actually have a lot of case management that, we have now for, the unhoused population. Through in-house, through DSS, we have the rapid rehousing program, we have case management through, Chapel House. Yep, there's Cayuga Health Network. I think we've really beefed that up over the last,
Yeah.
like 5 years as far as services, because that really is key.
Yeah, just trying to think ahead with the Medicaid. I think those services will become more critical in the next couple of years, probably, right?
Mm-hmm. Yeah. In the case management, although it focuses on their needing to get into permanent housing, there's so much more that goes into that than just finding a house. For somebody to be successful in getting into permanent housing, they really need to have other things covered as well. Mental health treatment, substance use treatment, to be successful. So it's really, they work on all of that. That's why all those other referrals are being made, not just find a house. That's a huge part of it, but it's also, let's get all this other stuff in order so that you're ready and able to get into permanent housing, pay the rent, take care of the apartment the way you need to, that kind of stuff.
Any other comments, questions, discussion?
Madam Chair, may we put this on the table?
I'm sorry. May I have a motion for HH6?
I'll move it.
A second.
Any further discussion, questions? Okay. Hearing none, all in favor of HH6? Aye. Any opposed? HH6 passes. HH12 and HH13 are going to be pulled. They are being pulled to the full legislative meeting after our Ways and Means meeting when we, make further decisions about pausing, if we pause, and what kinds of positions. Any updates? Anything else you'd like to add?
Our unhoused numbers right now, census as of 8/8, we had 21 families that we were providing some housing to and 94 singles. So consistent with, I think, last month's numbers, a little bit up from a few months before that, but not seeing a huge spike again. 21 families is a little bit lower.
Yeah.
Yeah, so I think, continuing, I think right now, with the weather being warmer, we're doing pretty good with these numbers. I'm still seeing some success overall with finding permanent housing for folks through transitional housing and some other opportunities for people. We do still have new folks coming in. And, we'll continue to work on that.
Thank you.
Any timeline on the HHAP board?
So we will know if the rescue missions application for HHE funding was successful in October. We did find out that there will be a meeting in October, an OTDA board meeting that will be making announcements of the folks that were funded. So we'll be tuning into that meeting, and on that day, we should know whether or not the application that they submitted was approved or successful in seeking those HHAP funding dollars. So that's not too far away, a couple months, not even.
And in the meantime, we have spent ARPA money pretty significantly of the 1 million that was
Committed.
appropriated.
Yep,
Because
appropriated.
there's so much engineering, those kinds of fees. So I know many people have been fearful about, will we get this money spent in time or will it be a loss? But indeed, we'll be able to spend that money in time. We've been assured and shown
Yeah, the timeline.
Earlier this-
If the HHAP money is secured and is funded, the timeline for the actual shelter build and being able to take clients into the shelter would be the end of 2027. So that fall time frame of 2027 would be when that shelter would be up and running if successful in, building it. Still getting information coming through from, various parts of, OTDA around the Act, Big Beautiful Bill, and the changes that are coming for SNAP, Medicaid. There was some information released at the end of, beginning of August, I think it was, that was, around the ABOD work requirements. They did, submit some toolkits for us to use, some different forms for us to utilize when we're looking at the work requirements for folks that we are have on our caseloads. So, getting familiar with those, and still other information that's coming around what we need to do and changes that we need to make. But definitely, it's definitely a lot of information to take in and a lot of information coming. You're shaking.
Are you concerned with the staffing that you have now being able to manage? Because it seems like the eligibility requirements and the hoops to jump through will be the difference between them getting the service. And so there's gonna be a lot of legwork that this population doesn't historically welcome. I
In
guess.
addition to the 3-month recertification period.
6 months,
versus- Is it 6 months?
6 months versus annually.
Versus.
For Medicaid. Yeah, for the work requirements for the ABOD population, I mean, that is definitely going to be
Able-bodied for people that are not.
able-bodied,
Yeah, the ABOD population.
yeah. So it's able-bodied adults without dependents. So it's for your single adults, basically, that have no restrictions or, the restrictions that, make it so that they're not able to work. So they have to seek work. They have to document that they're seeking work. They need to provide us with information on programs that they are engaged in, where they're going to look for work. And it is a lot. It's more for them and it's more for us. So for the DSS staff, tracking all of that, making sure people are given the information that we're required to give them about what counts, what they are expected to do and what time frame, and then taking all of that information and make sure that we're, screening, what to do with them from there. It is a lot. It's a lot more. So the administrative workload for DSS is higher. And whether that shakes out as whether I'm worried about if we're going to be able to manage it, I don't know yet. It depends. I mean, but it is a concern.
We were talking, you don't really know what the impact on the caseload is going to be either. Are there going to be so many people who say, I'm not doing.
Right, that fall off.
I'm not
Right.
apply for that.
Was it going to balance
Yeah,
out?
without a crystal ball, you don't know if
Right,
it's going to shake out that the caseload's far less and the administrative.
right. So then it could balance,
Right.
or it could be that, right, we just don't really know enough yet to know. But definitely changes coming. And it's definitely going to have an impact on us. We're, trying to figure out who's going to be able to do all of that tracking and taking all of that paperwork and
Find the
redo the
work
report
sites.
outs. Yep,
Find the work.
yeah. So,
The funding changes in October. Does the regulations also? Where you have to have a work requirement, or is that phased?
but that was immediate.
Huh?
The ABOD work requirement was immediate.
Oh, it's immediate.
Yep.
Starts now.
Yep.
So anyone coming in or is on food stamps that
Is it-
classifies as work eligible has to meet those requirements when they come in to recertify?
Yep.
And then the Medicaid, I think the insurance part is what phases later, right? They'll
There's a
eventually have to do that for their Medicaid.
Yeah, yes, there's a lot of fees and dates, so I can't, there's a lot of fiscal year 27, but when does that start? So there's over this fall and in 2026 and even into 27 and 28, there's different portions of this that phase in.
Timeline, if it's helpful.
Yeah.
Yeah, so keeping track of when all of this is coming is interesting too. I mean, because it's not all happening right now, all piled on at once, but it is stretching out over time, there's going to be like quite a significant amount of changes, but by 2027, 2028, all of these things will be implemented as they are, or as they were written then.
We're stuck in the legal world. We don't really know.
Right, I don't know if any,
Things have already been said they were gonna happen and then get pushed out. So I think it's smart to just handle it as it comes,
Yep.
but it's worth considering. It's gonna be a lot of administrative work.
agreed. Okay,
Thank you.
thank you.
And Maureen is here for Lauren.
Deputy Director for Mental Health.
So before the updates, let's go through the resolutions as well. We are pulling HH7 again to the ledge meeting. And again, same reasons, while we work to look at what will happen at Ways and Means and onto ledge with any potential movement or changes or lack of changes thereof in the current pause. So HH8 is amending the mental health 2025 budget to adjust state aid funding for contract agencies. There's more funding brought in, which allowed you HH to increase revenue to Cayuga Counseling, Nick's Ride, state aid to veterans, Liberty Resources, Unity House, Cayuga Homes, our own mental health contract, Chad, and Unity House for another program as well.
If it's just the standard COLA raise that we get for state aid.
And all the organizations you're currently working with get an adjustment?
Yep.
So I don't know if this is, Fred, worth an amendment, but in the third whereas, it just mentions the anticipated. I guess, no, that's correct, because they were not anticipated in 2024 to put in the 2025 budget. Is that how the language is read? I just wondered if there was just a,
Yeah, because these are increase in revenue, right?
Yes.
That was not anticipated.
So,
So
but not anticipated.
okay,
on that note, I'll move it.
okay, never mind. Can I have a motion to,
Move it.
thank you.
I'll second.
I think. Should I abstain? I work for one of the organizations listed.
You
Yes.
should be overly cautious, yes.
Okay.
Any discussions or questions on HH8? Hearing none, all in favor?
Aye.
All right.
Any opposed? Any abstentions? HH8 passes. HH9 is authorizing the Director of Community Services to accept funds from the Office of Mental Health for the Mobile Crisis Program. This is in the amount of $34,650 for the rest of calendar year 2025. The resolution also talks about it is part of recurring annual 100% state aid funding in the amount of $138,600 that will be added to the 2026 budget.
This is another line that wasn't anticipated, Madam Chair.
Yeah, this is,
No, we requested to OMH, we put in a request for increase in state aid to help offset the daytime mobile crisis cost, and they surprised us with an increase in state aid. So it was a pleasant surprise from New York State.
so again, not anticipated, just a nice little gift.
There was the original $80,000 from the city of Auburn, and I mean, those were startup funds and,
Yes.
and those were depleted. So in order to continue this, we had to find some additional funding.
Yes, and we requested it from OMH and they provided us.
Valued the program enough to increase your state aid to help continue this program.
Yes.
Okay. See, Bob, the state does things nice.
So is this the one you contract with or the one you do in-house?
This is daytime mobile crisis, so it's in-house.
Okay.
Any other questions, comments, discussion? All in favor?
Okay, we have a motion.
Put it on the floor.
Put it on the table.
I'll move it.
I'll second for discussion.
Okay.
Is, and I'm trying to be clear here. These funds, Counselor, were not anticipated. Is the fourth whereas necessary?
That's up with you. Fourth whereas. I believe that's in there to explain why we need to bring this resolution forward, because it wasn't anticipated. These are additional funds. The budget needs to be amended to reflect the increase in revenue and expenses.
Okay, that's fine. And I asked the question in reference to the fourth whereas, that they were not anticipated funds, but there was a request put in for funding. So let's just go with unanticipated. We'll leave it at that.
And, you know, good work on the part of the administration at mental health to think to request those funds and working.
We love daytime
Different
mobile
ways.
crisis.
Any other questions, discussion? All in favor of HH9?
All right.
Any opposed? Any abstentions? HH9 passes. HH10 is authorizing the legislature to, actually, I would like to bundle 10 and 11. At least these make a lot of sense. Create and fill 2 budgeted staff social workers through the HELP program with the Community Mental Health Center. HH11 is allowing the extension of 2 fills, and they're called create and fills again because of these are also HELP social workers through the HELP program. So I would ask for a bundle of HH10 and HH11.
I'll second.
Okay. These are positions that are part of the exemption list in our pause and have gone through the personnel committee. And as I said, HH11 is an extension of, you know, still searching, you know, after the 6 months of the first authorization. Any questions? Discussion? All in favor of HH, the bundle, HH10 and 11?
All right.
Any opposed? HH10 and 11 pass. Do you have any updates for us, Marie?
Just a couple. We just wanted to give everyone an update on some of the mandated services that we have going on right now. We're anticipating one person is going to be scheduled to go in for 7:30 placement. We have 2 previous 508 placements through, which means they went from the county jail right into a state-run hospital. They were both short-term. We still haven't received the bill, but we do have the budgeted funds to pay for the expenses once the bill does arrive. We just wanted to provide a positive update. We are able to fill the coordinator of substance use initiatives program. That took quite a while to find an applicant for that position, but we're very excited. It's an Auburn native who lived in Montana for a little bit, has relocated back to the area. So somebody returning to the community who's quite a bit of public health kind of experience. So Jeremy started last week. So he's just entered his 2nd week. So we're excited to have him be a part of our team. And then I guess to continue on the federal updates. We were very fortunate last week. We received national technical assistance for our SAMHSA Systems of Care grant on what we can do to increase infrastructure within our community, which really focuses on enhancing family and youth voice within the policies, procedures, and decision-making for programming. We had 2 full days of technical assistance, which was really an amazing experience. We had collaboration from the Department of Social Services, as well as Cayuga Centers, as well as Families Together in New York State. So we're really kind of excited for the plans to move forward and really kind of the positive impact that this will have on the community and all child serving agencies. Within that, the technical assistants shared, they were funded by SAMHSA. They did receive their no cost extension, which is good news, which means in the SAMHSA world, they didn't spend all their grant funds. They were given additional time to spend grant funds. So that is promising. We should be hearing for our SAMHSA Systems of Care grant. Our continuation is due soon. Last year, we received the year 2 continuation letter August 20th. So that means hopefully next week, we should hear we should receive the year 3 official funding. We haven't heard as much negative news, but we do know that our fiscal spending for SAMHSA is under a lot of scrutiny and how we spend money. So we're being very cautious and running everything through our project manager.
If you weren't to get that money, what would be at risk?
The infrastructure, but that we can kind of sustain through a lot of work. It's more the DBT in schools program that's directly impacting Moravia's school district. Moravia has their own grant that goes until October 2026, but this would impact Union Springs. It would impact Cato Meridian. And we're trying to increase the collaboration with Weedsport. So it's really kind of the integration of DBT, which is an evidence-based curriculum. And what we're trying to do is really work with the local high schools for social emotional learning. And this fits beautifully with what the districts have to do with the New York State standards. So we're trying to slowly get these skills built in right into this tier 1, which means every student gets this instruction. And then with our co-location of the therapists, we're able to provide groups as well as individual therapy for high-risk students. And just the value of being co-located in the rural districts just makes the life of our clients so much easier. But it also helps them sustain their time in school, and it doesn't have a negative impact on their education. Because often families will have to, it'll take 3 hours for them to go to a weekly therapy appointment. You know, you pick your child up from school, you have to drive to Auburn. More than likely, you have to feed them. And then maybe they go back to school, and on the day, maybe they don't. So it really creates the least amount of disruption in education with our co-locations in the rural districts. And it's also been a great opportunity to provide training for the staff. And with this funding, with year 2, we will be one of the first sites nationally to receive DBT in schools elementary training. So we are on the first list of communities, which is
nationally.
Yeah. Westchester is still the beloved county, but we're working there for their second most beloved community in New York State. But we're very fortunate that the Systems of Care grant has really allowed this expansion of an evidence-based program that we've really seen great results in the outpatient clinic.
Great news.
Thank you.
Yeah.
Okay, thank you very much, Maureen.
You're welcome.
And if there's no further business before this committee, do I have a motion for adjournment?
Second.
All in favor?
Aye.
Thank you.